Welcome to Smart PT. My name is Jonathan Reimer. This week we're going to be talking about treatment of the cranial vertebral region, specifically the Atlantoaxial joint. And this week I want to focus on exercise for the region. We all know that the Atlantoaxial joint, or hopefully at least we know that the Atlantoaxial joint is responsible for the majority of rotation in the cervical spine. So approximately 50% or 45 degrees in each direction of rotation of the C-spine comes from the AA joint. So it's a very important joint to identify and treat restrictions in. When I'm trying to determine if the AA rotation is limited, I tend to use the flexion rotation test. So basically with the patient in a supine position, I will flex the neck up to create a ligamentous myofascial type lock through the lower cervical spine. And then I will rotate the cervical spine to the left and to the right and determine where I feel limitation in movement and is it shy of 45 degrees. At that point, I'm going to try to decide, do I need to restore right or left rotation? Generally, it's one or the other. Sometimes people need both, but there's usually one that's more restricted. So what I'm going to do for exercises, let's say that I have a restriction in right rotation. It's only about 50% of the normal, so maybe around 20 to 25 degrees of right rotation. What I'm going to do for exercises is I'm first going to start with a towel stretch that the client can do. Basically, they're going to lever the towel on the right side of their neck. They're going to wrap the towel around the left side of the neck at the C1 on C2, so right up underneath the cranium. The right side is going to hold the towel stationary, and the left is going to pull into left rotation. Going to create a stretch. The client can oscillate and mobilize the towel, or they can just do a long, prolonged stretch in that area. So basically following the towel stretch, what I'm going to try to do is isometrically recruit a couple of different muscles. The rectus capitis anterior inferior, which comes from the occiput down to C1, and the inferior oblique capitis, which comes from C1 to C2. Together those muscles will create a rotation of C1 on C2. So what I'm going to try to do is basically have the person rotate near the point of restriction. So we said about 20-25 degrees in this case. And at that point, I'm going to have them isometrically try to rotate their temple against their fingers into right rotation about 5 or 10 times for 5 seconds. And then with their other fingertips, I'm going to have them place them on the mastoid, and they're going to try to rotate back against. You can try either doing one or the other or alternating back and forth. And then basically that'll create recruitment of those two muscles that I was just talking about to produce C1 right rotation on C2. I also like to, of course, when I'm working in this region, work on deep neck flexor strength for stability. So if this was interesting and informative, we're going to look at this more in depth in the next few weeks, including mobilization of the region. We also have upcoming course dates that you can check out, and you can always check out our website at smartpt.ca.